Hi, everybody. My name is Neil Seidman, and I'm co-chair of the Public Education Committee for ADAA. That's the Anxiety and Depression Association of America. And welcome to our webinar, Overcoming Agoraphobia. And we're so happy to have our presenter, Dr. Karen Cassiday. So this webinar is presented by ADAA. This is the leading nonprofit organization in the field of anxiety and depression. And we really want to invite everybody to take advantage of some of the amazing resources on our website. That's adaa.org. So for our live audience, just take a moment to find the Q&A link so you can type in your questions. If you're on a smartphone, if you tap anywhere on your screen, you should see a menu at the bottom that has a Q&A link. And if you're on a laptop, take a look at the bottom of your screen near the center to see if you can find that Q&A link. And then for our audience that's watching the recording, you can email a question to webinars@adaa.org. So I'm really happy to introduce our presenter, Dr. Cassiday. Thank you so much for joining us. Dr. Karen Cassiday is a nationally recognized expert in the diagnosis and treatment of anxiety disorders in children, teens, and adults. She has conducted extensive research into anxiety and is widely published. Dr. Cassiday is the past president of ADAA, and she's a founding fellow of the Academy of Cognitive Therapy. Dr. Cassiday is a sought-after speaker on TV, radio, at professional training seminars. She's appeared as a consultant on NBC's Today Show, and her expertise has been featured in publications like the Wall Street Journal, the New York Times, and numerous others. So let me turn it over now to Dr. Cassiday.
Hi, everyone. Thank you, Neil. I am so glad all of you showed up because the most mistaken thing that people think about agoraphobia is that it's funny and that it's not serious. Well, I'm here to tell you, and hopefully you already recognize this in yourself or the person you love or support who has agoraphobia, is that actually it's a really difficult problem that people face. And there's a lot of misunderstanding about it. A lot of people think it means that you just can't do stuff like hang out in the movie theater or sit in a dentist chair, or that you just can't be out in public. Well, what we really know about agoraphobia is it's not so much about the place that you're afraid of, it's that you're afraid that you might have a panic attack. And so when clinicians, such as myself, think about agoraphobia, what we really are imagining in our mind is someone who's afraid to do something because they believe that if they go somewhere or they do something or they experience something, they might accidentally trigger a panic attack. And so people who have agoraphobia are in this desperate search to try and find where are the places and the situations where I can guarantee that I won't feel that way, that I won't get this sudden surge of all these horrible anxiety symptoms. And what I mean by a panic attack is where you get this sudden surge that's unexpected, at least initially for the first couple of panic attacks, and you get a host of all kinds of anxiety symptoms. And it can be stuff like feeling like you're going to lose your mind, you're going to have a heart attack, you can't breathe, or you won't get enough air. You could feel shaky, you could feel sort of electric tingly sensations, or feel like you're numb, or you suddenly have this wave of intense fatigue, or it could be stomach upset, like I'm going to vomit, or be nauseous, or have sudden diarrhea, or butterflies.
This is a pretty overwhelming list, Dr. Cassidy.
Actually, it is. It's a horrible list. And
yeah.
The best way I think of panic attacks, because I have had them in my life, most notably in the dentist chair, or before I thought a truck was about to hit me when I was skidding across the ice in my little bitty Prius. Is a panic attack is like when that boy who was too big held you underneath the water in the public pool too long. You know that something terrible is going to happen now. That's a panic attack. And we know that people who get it are actually very reasonable. There's nothing crazy about them. We haven't been able to identify anything that says people who get agoraphobia have a personality flaw. What we do see is that they recognize I had a panic attack in this situation. And then they're trying to desperately figure out, okay, how can I make sure it doesn't happen again? And so they try to escape quickly from the situation and figure out how to get safe.
So Dr. Cassidy, what I'm hearing when you're explaining what is agoraphobia, it isn't the activity itself, it's the fear of having this just terrifying experience.
Absolutely. Yeah. And so I'll give you some examples that some of you may have or may not have thought of. I have people where they're afraid to get angry because when you get angry, it can accelerate your heart rate. It can make you sweat. It can make you tingle. And that's just like the symptoms you could have in a panic attack. And we know that what happens with the human body is that if you're someone who inherited the genetic tendency or risk factors to get an anxiety disorder, then your body becomes more easily dysregulated and it conditions to fear situations more quickly than other people's. And
now,
so
the panic attack that is so terrifying to me,
yeah,
could it be physically dangerous to me?
I love that question. We know actually that it's totally benign. And I want you to think of it this way. There are people, we call them thrill seekers, and they do extreme sports, you know, where you like jump off a mountain and you try and ski or snowboard down, and they're invoking the same set of symptoms. It's just their perspective is this is thrilling as opposed to this is terrifying. They're getting the same level of heart rate increase, adrenaline release, all of that. The difference is that people who have agoraphobia have what we call anxiety sensitivity. And this is where you're afraid of the physical and mental experience of feeling afraid. And I want you to think about it this way. There's some people in the population that pay really good money to go to amusement parks and plunge hundreds of feet on a ride, which I find quite uncomfortable because of the anxiety experience, and they do it for fun and they're having the same experience. So we know it's benign, it's terrifying. And that's the problem is it's how you perceive your ability to manage that feeling of terror and whether or not you accidentally discover the idea of negative reinforcement. Where let's go to the next slide, Neil. So let me describe how agoraphobia works, because what's so tough for so many people I see is they say, well, I've tried, getting out, I've tried driving on that expressway, but I just can't do it. And so here's what we think happens when someone starts to develop agoraphobia is they have their initial spontaneous panic attack. It comes out of the blue. They weren't expecting it. And then because your body is hardwired to pay attention to fear and to prefer safety, your brain and your body start looking for the quick escape because your brain's kind of stupid. It can't tell the difference between an imagined threat or a real threat, such as a semi about to hit your car or falling off a cliff. It has the same reaction whether it's a benign panic attack, sitting in a dentist chair where nothing dangerous is happening, or having a true terrible accident. And then you try to get out quickly while you're still at the peak level of panic. That means you get off the expressway fast. You go back to your house fast. You quickly leave the hair salon instead of sitting in the chair. You make an excuse to leave the auditorium. Oh, I have to go to the bathroom, and you don't get back in. And then what happens is your body and brain go, thank God. And then you accidentally made the next time you think about or attempt to go to that scary situation provoke even more anxiety, because your body's remembering, uh-oh, that was bad, don't go there. And then because of that, you start to get wary, and you start to become hypervigilant for anything that might create a sensation that reminds your body of panic, or that seems like that situation where you felt like maybe I'm trapped and I can't quickly get away in case I have one of those horrible episodes. And then you start avoiding because you're getting wary. And then unfortunately, because you're wary, your anxiety level is elevated because you're assuming, what if I get another one? And you're slightly anxious, and it becomes easier and easier to get another spontaneous panic attack, not only in the situation that initially caused it, but that anything that's kind of like it. And this is how you can go from one day being able to go to your college classes and having a horrible panic attack in the middle of the class and running out, and then a week later not being able to go to any class.
So it can feed on itself.
Absolutely.
And when I'm looking for the escape and I'm being wary, that's not actually solving my problem.
Yeah, it's kind of like you're feeding kindling into the fire, and then you're surprised when it flares up suddenly. And that's what that wariness and trying to play it safe happens. And so this is one thing that's very important to understand, because it's the thing that makes the difference if you understand this and you combat it in terms of recovering, is that it's that trying to make sure you never have another panic attack by trying not to do anything that might provoke it or be in any situation that actually gets you in trouble. Because we do know there are people who get genuine panic attacks who don't get agoraphobia. They just sort of white knuckle their way through things. They get on the plane, they go back to school, they get themselves into the meeting at work. But that's because they're making a different assumption. That assumption is, this feels awful, but I know I can handle it. I don't have to do everything I can to make sure I have another panic attack. So the people with agoraphobia, we know, are the ones that have the most of this anxiety sensitivity, more than any other anxiety disorder. And it's something that we really want to treat and help people with. So let's go to the next slide. So one thing that you want to know is that right now, depending on where you study it around the world, about 1 to 2% of the population has agoraphobia. And it doesn't matter how educated you are. It doesn't matter how young or old you are. You can get agoraphobia. And I see kids in grade school or kindergarten who have agoraphobia. And in fact, we know that the single biggest reason that young women drop out of college is because of agoraphobia. And this was a study that was done some years ago with ADAA and some other organizations. It was kind of a surprise finding. We know that women are more likely, or girls too, are more likely than men to develop agoraphobia. And we don't know whether that there's some fundamental biological difference that has to do with hormones and how they experience panic attacks that is the difference, or if there's subtle cultural differences that say it's more acceptable for women to bow out of an activity or to use safety signals such as, I can only go places if I have my children with me or my dog with me. And men don't have the same freedom to, perhaps avoid that women do. We don't really know for sure yet, but we do see that. And then the other thing that we see is when we see young children having that, we know that it's a really big reason for school refusal. And a lot of times people are assuming that school refusal is because they've been bullied or there's social anxiety, which of course is another big reason, but the overlooked reason is kids are getting panic attacks in school. And because oftentimes the way they'll describe this is I have a tummy ache, or I feel sick at my stomach, or a headache, then it's not getting cataloged or registered as this child has panic disorder and agoraphobia. The other thing that I mentioned earlier is it happens across all ethnic groups and races. So I've had some people who thought this is like a white person's problem, and Black people don't get it. Well, I'm here to tell you that is not true. And it can happen to anyone. And so the big thing that we know sets you up for it is what's your genetic heritage? And then also, did you happen to grow up in a family or a community that accidentally taught you it's dangerous to get scared, and that you should quickly try and comfort yourself, and that it's not okay or not permissible to just feel scared? We call that overprotection. And we know that if you're in an environment that supports that, then unfortunately, that's going to make it easier to get agoraphobia. And we do see that we are getting increases in youth, in teens and young adults in prevalence of agoraphobia, where we see about 3 to 4% now. And that's an increase from 20 years ago. And we suspect that one thing that has happened is we've accidentally overemphasized getting comfort when you're scared or when you're distressed, and immediately rushing in to help our kids the minute they feel distressed, in a mistaken effort to teach them how to cope. And what that accidentally does is it creates that negative reinforcement situation where the child or the teenager doesn't get to learn that my panic attack will pass. And I want to
So they're learning, unfortunately, the wrong thing, learning to
yeah,
escape from the discomfort, or
yeah, that
avoid
I'm too fragile. And I want to give you a fun fact. And this is something that doesn't get mentioned a lot, is when we hook people up to all these fancy machines that measure their electrophysiological and body responses to a panic attack. And then we do something that sounds cruel, is we induce a panic attack by giving a bolus of caffeine or lactated ringer solution, which is the sterile solution in an IV. We see what happens is the peak part of a panic attack is done in usually 90 seconds to 3 minutes. And that it's this brief, horrible blast. The reason it feels so long is that when you're in the middle of an anxiety attack, it changes your perception of time. It makes things feel very distorted, and you feel overwhelmed, and it feels infinite. But the reality is, when people are saying I'm having panic attacks all day, we see they're scalloping, and they're not actually having one solid panic attack. And there's a very good physiologic reason for this. It is that after about 90 seconds to 3 minutes, all the little receptors in your brain and your body that fill up on those fear chemicals, the chemicals that create that sensation, get saturated. And then no matter what, they can't give you any increased sensation of fear. And then they have to rest momentarily before they can uptake more chemicals. And that's what we take advantage of in treatment, is we realize that if you stay in the situation, your body can't keep getting more and more scared, which is what your mind is telling you. But your body will start to realize, wait, nothing terrible is happening. I'm actually down regulating. And then you start to have the experience of mastery and realizing it's not so bad.
If I could get myself to stay in that situation, and it might only be 3 minutes that it might take, then I might be able to see the panic start to come down, and I didn't have to escape.
Yes. Yeah. And so, and that means even if the whole time you're trying to scream and go, oh my God, no matter what, your body is going to get used to it, even if your mind is completely unconvinced that this is okay. And I can give you a good example of that in my life. I used to have a horrible phobia of snakes. And I mean, like when I saw the movie Raiders of the Lost Ark for the first time, I had to have my feet up, cozied into my knees because I just had the feeling like, what if snakes got in the movie theater somehow? And it was very hard for me to walk out because I was constantly looking for snakes, and it really made life difficult. And then after I became a professional, I had a kid that said, I'll do my exposure if you do yours. And she had a boyfriend whose family owned one of those reptile shops. And she did her exposure. And I assumed, like most kids, the minute she was done with treatment, she'd never see me again. She'd be so glad to have her normal life. Who wants to come to a therapist for fun? But 3 months after she was finished, she called me and said, Dr. Cassiday, it's your turn. We're doing exposure. And I was honor bound to show up. So I went to this shop, and over an hour and a half, I held a baby ball python and let it crawl all around me. And she was wonderful. She clearly had learned how to do exposure therapy from me and took me through my paces. But what happened is I completely got over my fear. And I treat people now for fear of snakes, and I'm happy to rent or borrow pythons and other little slow-moving, harmless things to help people with. And it was a very interesting experience to go through that and go, yeah, this stuff really works well. And so I want you to remember that there's absolutely nothing wrong with you. It's just your body has this hair trigger for handling fear-provoking situations, and it's your job to try and overcome it by reversing the process. So let's go to the next slide. So the reason I have this picture here is because it gives me a little bit of the gizzies in my stomach when I think of leaping over a gulch and, something that's really tough. And I know every time I do treatment with someone, that's what I'm asking them to do. On the other hand, I know that also I'm asking them to step into a way to live with great freedom. And so we see there's a couple of hot tips to helping you overcome agoraphobia. And one is you've got to practice doing the opposite of what your agoraphobia begs you to do. You've got to try and get into the situations where you suspect you might get an anxiety attack or a panic attack, or you'll get one. And that means being willing to get anxious. And that's a big ask. I know that because I know whenever someone comes to see me, regardless of their age or how much they've read on the internet about treatment, what they're really wanting from me is make me feel good, Karen, make me not feel this way so I can do all these things that have become difficult for me to do. And instead, what I'm asking is to learn that you're tougher than you knew you were, and that you're more courageous than you ever believed. And that in fact, once you face what seems like a terrible jaguar about to pounce you, it's just a kitty cat, and that you can handle it. And so one of the steps that we do to help get you or other people like you ready for that real life exposure is we do something called interoceptive exposure. And there's going to be a link to that, a video that I did with CBS treating a man who had agoraphobia for years and years and couldn't leave his apartment, showing interoceptive exposure. What interoceptive exposure means is you're deliberately trying to create the physical sensations in your body that are likely to trigger an anxiety attack or a panic attack. And the reason you're doing that is you're trying to teach your body, if you feel a little bit sweaty or hot or get that butterfly sensation, or your heart beats faster, or you feel shaky or electric or tingly or out of breath, it's just an uncomfortable sensation as opposed to an automatic trigger to a panic attack. And let me give you some examples of what I mean by bringing on physical sensations. So things like breathing really fast so that you hyperventilate. And this is a really good one because when you hyperventilate, and I'm going to show you right now, it's where you go, where I'm forcefully blowing out all the air. you're over
That
exhaling.
brings up a lot of sensation when I do that.
Yeah, I know right now I feel lightheaded and dizzy and kind of hot, cold rushes, which is very similar to a panic attack. You're over exhaling carbon dioxide. And when that gets too low in your bloodstream, it makes your bloodstream what we call alkaline, more alkaline, and it triggers all the symptoms of a panic attack. And if you're someone that has anxiety sensitivity, you're likely to get a panic attack. If you're someone else, you'll just go, oh, that's weird. And in fact, I remember playing a game as a kid where we would hyperventilate on purpose just to make ourselves feel weird. And we thought it was fun and funny to have all those things go, oh, I'm so dizzy. Well, that's one thing, is to hyperventilate like that and to do it until you feel weird, and then to do it for a few seconds more. And to do this repeatedly until instead of getting anxious, you just feel weird. Another thing, and I'm sitting in a spinning desk chair, is to spin in a desk chair and make yourself dizzy. So if you feel dizzy or lightheaded when you get anxious, then you want to practice dizziness or lightheadedness. If you feel like you're depersonalized or things are surreal, where you feel like I'm not really connected to the situation, then doing that acute hyperventilation is the best, fastest way I know to get that feeling. If you feel like my chest feels tight or I can't breathe right, then breathing through a straw and then working down to breathing through a coffee stirrer, you know, those little tiny itty bitty straws that you stir your coffee or your tea with. So sneak a few of those from the next coffee shop you go to, and you can use that. If you're worried about getting out of breath or your heart racing, then running in place, jogging in place, doing jumping jacks. I have patients run up and down the steps in my office. Those are great ways to do that. If you're afraid of getting hot, then sitting in a car in the hot sun without any air turned on and the windows rolled up, or wearing a heavy sweater and heavy sweats and going out and walking when it's really warm outside.
I'm going to get used to these symptoms.
Yes.
You're not going to
Yeah.
be as scared.
And the whole idea is you're trying to think, what are the physical feelings I get during a panic attack? And then how can I, one by one, make that happen? Using the acute hyperventilation usually captures the most symptoms of feeling weird, surreal, dizzy, tunnel vision, where you feel like it's dimming around the periphery. And we know that unless you are pregnant, then doing this acute hyperventilation is perfectly safe. If you're in your second or third trimester of pregnancy, then we don't do the acute hyperventilation because we just don't want to, this does not affect oxygen, but we don't want to make the baby uncomfortable. We don't really believe it's dangerous, but it's not recommended. But this is doing all these activities is totally safe, even if you have high blood pressure or hypertension. And if the doctor has said you can walk up 2 flights of stairs after your cardiac surgery, then you're good to go on this kind of practice. So what I do with patients is I practice these sensations with them, and they practice them at home, and you do it over and over until you get used to it and it's not scary anymore. And the exciting thing is, I found for a lot of patients, usually you can get that done within a couple of weeks if you're willing to practice every day for 10 or 15 minutes. And that your body actually uncouples this automatic response pretty quickly. And then what's so cool about this is then you can do the real life situations you're scared of, and it's easier to imagine yourself doing them because your body's not going so haywire, so crazy. And at that point, then what's exciting is you can then do stuff like saying, okay, if I can only drive 3 miles to the north and 2 miles to the south, then I'm going to try and expand my route. I'm going to go 1 street farther. I'm going to go 1 stoplight farther. Or if you can only do things if you have your dog with you or your kids, or your cell phone. That's a big safety signal for a lot of people. Then you practice walking around the block without your cell phone, driving without your cell phone, driving without your pills. I have a lot of patients that use their container of Xanax or Ativan as their safety signal, thinking if things are really bad, I'll pop one of those under my tongue, and practice not doing that. And then the same thing is going to happen is if you practice it and stay in the situation until you can tell that peak uncomfortable sensation is past, what I can guarantee you is it's going to get easier. The thing I can't tell everyone is how long does this process take? What I can tell you is the more you're willing to do it and the more often you're willing to do it, the quicker it goes away.
And so just starting to see some progress could really make a big, big change.
Oh, for me, that's the most exciting thing. And oftentimes this happens the first time we do interoceptive exposure is someone's like, oh my God, I can't believe I just did that. I can't believe I just had a panic attack and it went down, and I'm doing this a second, a third, and a fourth time, and I can't even get myself to have a panic attack.
This has been such a wonderful introduction in just a short time. I wish we had more time. I'm hoping we can have you back to do a part 2. For people that are watching live and the recording, you can email in your question, and people that have typed in a question in the chat, we're going to do our best to address your questions on ADAA.org. So keep an eye out for that. We just have time for a couple of real quick questions, like lightning round. Okay.
Yeah, give me the question.
Okay. So I've had agoraphobia for over 10 years. It got worse during the pandemic. Is it too late for me to recover?
Absolutely not. Our research shows you can be 98 and have had it your whole life, and your chances of recovery are the same as someone who only had one panic attack. So go for it.
Okay. And one more question. Do I need to see a specialist, or will any counselor be able to help me with my agoraphobia?
You actually need someone who knows how to help you with exposure therapy. The good news is you can do this on your phone as well as in person. If you go to ADAA.org, you can easily find people, and you're looking for people that say, I do exposure therapy or exposure-based therapy. And other therapists usually don't know how to do this, or they're afraid to do it because they misunderstand what's happening when someone's having a panic attack.
So that'll lead us into our last slide. So everyone that's watching, ADAA.org has a list of treatment providers. You just tap or click on the Find a Therapist link. We also have a free peer-to-peer support group. And then finally, you can support ADAA by making a charitable donation on the website. And I just want to thank everyone for watching our brief webinar. We encourage you to like it and share it. Thank you so much, Dr. Cassiday, for helping us get this start in overcoming agoraphobia. And again, everyone that's watching, take a look on ADAA.org for Q&A questions that we're going to try to address from our webinar. And Dr. Cassiday, we hope to have you back soon to maybe do a part 2.
I would love to. And my fondest wish is that every one of you who struggles, there's some wonderful questions, is I want you to know there's hope for you. ADA can get you to the right resources, and no matter how long you've had it or how worse it's gotten, you can get better. I've seen it happen. I know it can happen. You just need to get to someone who can help you do that. Bye-bye.